Good morning. Myself Priya. Today discuss about pneumonia. First of all, introduction. Pneumonia is an infection that affect one or both lungs. It causes the air sac or alveoli of the lungs to fill up with the fluid or pus, bacteria, virus or fungi. The most common causes of the streptococcus in a pneumonia. Pneumonia can be prevented by the immunizations and adequate nutrition. Then, next, definitions of the pneumonia. Pneumonia is an inflammatory process in our lungs, parenchyma, usually associated with a marked increase in the intestinal and alveolus fluids. Next definitions of the pneumonia. Pneumonia is an inflammation of the lungs caused by the virus, bacteria, and chemical irritations. It is the serious infections of inflammations and which is the ear sac filled with the pus and the other liquids. Next one, causes of the pneumonia. First, bacterial infection. Bacterial infection, it means pneumococcus streptococci. Second one, virus infection. Most common virus in influenza, chickenpox and measles virus. Next, fungal infection. Other and histoplasmosis. Other causes, aspirations of the amniotic fluid, foreign body and chemicals. Next one, risk factor. Risk factor, it means low birth weight baby, lack of the breastfeeding, poor socioeconomic status, overcrowding, malnutrition, immunosuppressed therapy, chronic disease such as the chronic lung disease, heart disease, diabetes. Next one, pathophysiology. First of all, enter the causative organism, increase attachment of the streptococcus pneumonia to the receptors on respiratory epithelium. Next, inhalations into the alveolus leads to the infect types of second alveolus cells. Then, multiplication in the alveolus invade alveolar cells leads to the spread from alveolus to the alveoli through the pores cone, leads to the inflammations and the inflammations. Then clinical manifestation. First of all, tachycardia. Tachycardia, it is the increase of the heart rate, dehydration, protective cough, pain or phleretic chest pain, fever rapidly rise, respiratory distress, nasal congestions and the sore throat. Hypoxia is it means lack of the oxygen. Cyanosis, it means bluish color of the skin. Dyspnea, vomiting, refuse of the food. Next one, diagnostic evaluations. First of all, history collection, present history collection, past history collection, and medical history also collected. Next one, cough color of the sputum, pan fever, physical examination. It means physical examination, head to toe examination, chest X-ray will be provided informations about the location or extent of the pneumonia, and culture sensitivity of the blood and sputum test also. Then bronchoscopy, ABG analysis. ABG analysis means airway blood gas analysis. Then medical management. Three management also necessary. First, medical management. Next one, surgical management. Then nursing management. Medical management, it means oxygen inhalations provide to the patient, chest physiotherapy, post drainage, antibiotic therapy, broad spectrum antibiotic to be provide the patient. Next, administrations of the bronchodilators, nasotracheal suctioning also provided. Next one, surgical management. Surgical management, it means drainage of the pleural effusion by continuous suctioning, postural drainage, thoracectomy, lobectomy. Lobectomy, it means to remove the one part of the lungs infected. Next one, nursing management. Nursing management, it is provide the proper positions, administration oxygen therapy, administration nebulizations, teach coughing exercise, encourage the client to the take more fluid. Next one, nursing diagnosis. In infected breathing pattern related to the increased secretions as evidenced by the marked respiratory distress. Next, nursing diagnosis hypothermia related to the inflammatory response as evidenced by the increased body temperature. Then complications, so many complications occur during the pneumonia, just like lungs abscess, respiratory failure, pleural effusions. Then summary. Summary is a form of acute respiratory infection that affect the both lungs. The lungs are made up of small sac called alveoli, which fill the air when a healthy person breathes. Reference books Parul Datta and Madhu Gupta. Thank you.